Thank you, Eric. We have had a hard-working group, and that group continues to work to be part of this debate and part of the solution. The Healthcare Solutions Group hopes to be just exactly that, and Republicans in the House are for a health care plan that's more affordable, that everyone has access to, regardless of any pre-existing condition they had, with a renewed focus on quality and the doctor-patient relationship. Democrats know that Americans who have health care coverage now generally like it, and that's why they constantly say if you like what you have, you can keep it. We believe, and everybody analyzing that future marketplace seems to believe, that if there's a government competitor, you will not be able to keep what you have. Because if there's a government competitor, the government will never compete fairly, and before you know it, there are no competitors. So what you had is no longer available for you to have. In fact, we'd add a caveat to that: if you like what you have, you can keep it, but even you should have more choices than you have today, even if you like what you have. More of a marketplace, more access to individual decision-making in healthcare. One of those decisions might very well be, I'm pleased to continue to have the benefit of the insurance I get from my company, or it might be, I want to take the tax benefit and go out and have the same kind of benefit with a plan that better fits the needs of my family or myself. And we're going to do everything we can to do that. There are ways to get uninsured people on the insurance rolls without having a $1 trillion price tag. And we'll be talking about those. There are ways to make Medicaid more efficient, and also ways to be sure that everybody who has access to Medicaid knows they have access to Medicaid and gets on the Medicaid system or the S-chip system. Many of the uninsured today actually qualify for existing programs. 10 million of the uninsured today have insurance available to them at work. And so, among other things, we think employees should have to opt out aggressively of choosing their insurance at work, as opposed to aggressively have to opt in. There are things like that that can make a big difference in the system in a hurry. And on that groundwork that government will never compete fairly, I mean, look what's happening right now in the auto industry. The government-run General Motors with GMAC financing for a car is close to zero. Ford Motor Credit, it's quite a bit above zero. For those that say this is just another competitor in the field and it won't make any difference, it just makes competition bigger, there's no fact ever that bears that out. The government will not compete fairly. We believe there's a big marketplace beyond today's marketplace that we can help create. And our members are going to come up and talk about that. Mr. Camp from Ways and Means, Mr. Barton from Energy and Commerce, Mr. McKeon from the Workforce Committee, Jenny Brown-Waite, and Charles Bustani are going to come and just talk about elements of the plan we'll be working with the drafting folks on, and hopefully while we're almost always last in line with the resources available to Congress these days, we're going to be working hard now to bring these concepts into legislative language as quickly as we can. Mr. Camp.